Hello, welcome to today's edition of Instagram Live where we talk about vitamin D. I am just going to try and invite Dr. Adepero um, before people start joining me. Hello, Ronke. Thanks for joining. I'm just going to try and invite Dr. Adepero to join me. Where are we? Hit a bell. Yeah, adding. We're just going to wait a little bit for others to join. Hi, John. Thanks for joining me right on time. Let me share this um, on my. Okay. Hi, Tim. Thank you for joining. Sunset, thank you for joining. I think, okay, I'm just waiting for Dr. Adepero to join before I start. Maybe I should play some music to liven it up a bit. Hmm, Just a second. Okay. Oh, there she is. Hello. Let me see. I invited you to join. I'm not sure. Let me invite again. Oh, there you are. Oh my
I'm
gosh. Hello.
here, and I think I have to adjust stuff for a while, a little bit. I'm hoping that this is okay.
Of course it is. You look stunning. Oh my goodness. I try to make an effort to wear like a big necklace and all of that to level up because I know you're a
Oh
proper fashion.
no, oh no. That is, it's just making the house look good.
Yeah, I like that. Yeah. Hi, wow, Instagram names can be quite difficult. I think that's Jele Ajele. Oh, can't say that. But yeah,
Oh,
thanks for
Angela
joining.
is my friend. She's a very dear friend of mine. So thank you, Angela,
Okay.
for joining.
Uh, So it happens to be your first Instagram live. I didn't realize you hadn't done one before. I just
Well,
found out.
you know what? I'm wrong. I have done Instagram Live before, but it was when Instagram was not so evolved. So we had to have two cameras, one for Instagram, one for Facebook. But I
Oh,
know that everybody has evolved beyond that at this time.
yeah, yeah, yeah. But yeah, where do I start? Do you want to
Yeah.
please introduce yourself?
Int-
But before you do that, I just want to say before you introduce yourself, I just want to say thank you so much, right? I didn't pay her for coming here today. I just said, would you join me? And she's like, yes. And busy Saturdays. I mean, you work Monday to Friday. I mean, your practice. So giving me this time and the audience this time is, I'm so grateful. So thank you so very much.
oh,
Okay.
all my peeps are
All my
joining.
all my peeps are
There.
joining. Yeah, that's great. So, please introduce yourself.
Okay.
Let's hear.
Okay.
Okay.
I don't know if you
I don't know if
can
you
hear
can
this, but
hear
I can
this,
hear
but
this.
I can hear
This.
this. Let me just say.
I don't know. There it goes. It's gone.
Oh, that was me. I tried to put my phone on Do Not Disturb, but
Oh, someone
then something.
was trying to get a hold of you. Yes. Okay. I understand. Well, my name is Dr. Adepero Okulaja. I'm an internist and I'm also a pediatrician, but I stopped practicing active pediatrics about, I think about 18 years ago. But I still see children, but for special reasons. I'm an internist, like I said, but I have an integrative medicine, internal medicine practice here in the Twin Cities in Minneapolis. It's called the Doctor's House. I'm also someone who likes to explore other parts of their personality. So I am a speaker, I am an author, I am a singer, I am a poet. I always say I am everything I want to be, or anything I want to be.
And you sing really good songs, you write amazing, you speak well, and it's interesting because all these things you've said, you're not mediocre in any of them. So that's incredible, and that's really commendable.
Oh,
Thank you for
thank
sharing your
you,
gifts.
thank you, thank you.
Yeah. Okay, so some of you already know me. I'm a wellness coach and nutritionist. I love to talk about wellness. And what I like about Dr. Adepero is her approach to health. She really loves to talk about the body, the mind, and spirit, and just cater to the whole of you. And that's one of my biggest, I'll say, ethos for practicing anything. I don't just believe you look after your body and then spiritually you're sort of dead. You've got to have that balance, and that's what you do in your practice. So yeah, it's such a privilege to have you here. So we're here today to talk about vitamin D.
Ooh,
Vitamin.
one of my favorite topics, and I'm going to ask for a bit of a break. I turned on the fireplace and it is very hot here. So that I don't get uncomfortable with this light, and I'm going to have you give me like 2 seconds. I will be right back. I'm sorry.
Yes, no problem. Yeah, yeah. Oh, wait. Hello, Arare Healing Hub. Thanks for joining us. I hope I'm saying that right. Mm, we just wait for her to come back. I'm so excited about today's topic. I always wonder, like, what's the big deal about vitamin D? What is the big deal? Why do we have to talk about one vitamin out of all the other vitamins and minerals and nutrients? So
Okay,
be interesting. Great, you're here. Uh,
I'm back.
so
Okay.
the topic for today is vitamin D. What's the big deal? And people actually wonder what the big deal is. Um, Personally, I tend not to blacklist any food or say this nutrient is better than this nutrient. God who made all nutrients, he made it for everyone for different purposes. So, you can't say I would not say eat carbs and don't eat protein, or eat protein and don't eat carbs. I'll talk about your portion, the timings, but never blacklisting anything. And today we're talking about just one thing. So I guess my first question is, what makes vitamin D so special? Why is it worth an Instagram live?
Oh, wow. Well, first of all, there is this widespread belief that vitamin D is a vitamin. It is actually not a vitamin. It's a hormone. It's a hormone. What disqualifies it as being a vitamin is the fact that we actually produce vitamin D in our bodies. The definition of a vitamin is a substance that is essential for life that we cannot produce in our own bodies, that we have to either take it in form of supplements or through our food. So because we make these vitamins, because we make vitamin D, it really doesn't qualify to be a vitamin. And when we look at the structure of vitamin D, it actually closely resembles that of the sex hormones and cholesterol. You look at the structure, and
Mm,
we'll get into that a little bit because we really need
mm,
to understand how vitamin D gets into our bodies so that we can understand the whole scope of what it is. I always have this, I always say this to my patients that God is an amazing God. He knew how integral vitamin D is to our survival, and he entrusted the largest organ in the body to produce it, the skin.
mm,
And it's amazing. I consider myself blessed to have discovered vitamin D. Vitamin D is almost like a person to me, you know, because
yeah,
because I discovered vitamin D quite serendipitously, and maybe we'll get into that later. But vitamin D is very important because it is essential for life. It is essential for life. I like asking questions, and when I talk to my patients, I say, okay, so I believe that we were made from the soil. Don't hit me. Don't crucify me. But the reason I believe that is because every single element, every single substance that is in the earth can be found in our bodies, including gold and silver and other trace metals that we don't even have any idea are in our bodies. So we
Mm,
were made from the earth, and that's why we should eat from the earth, not from the grocery store. That's a story for another day. We're from the earth. We should get plugged in. That's why grounding is so important these days, that you connect back to the place, just like docking your cell phone. It's important that you dock yourself every once in a while. We've come away from walking barefoot to wearing shoes, so we don't get connected to where we came from. And it's very important, especially in terms of the whole pathogenesis of vitamin D deficiency and everything. So I tell my patients the four things that we need to live are air, water,
mhm,
um, sunshine, nutrients from the soil. Okay. Now the plants, it's the same thing: air, water, nutrients from the soil, sunshine. So I give this analogy that if you have a plant that's supposed to be in the sunlight, and you take that plant and you put it in a cupboard, what's going to happen to it? It's going
mm,
to die. It's going to it's going to wilt. It's going to become yellow. It's going to become, after it becomes yellow, it becomes flimsy, and then it'll die. Why? Because it cannot produce chlorophyll, which the sun, it requires the sun to make chlorophyll. And that's the same way human beings are. If we are not in the sun, we will die. If we don't get exposed to the sun, we will die. A few years ago, like maybe 10, 15, 11, 20 years ago, I don't remember, but Nigeria was voted the happiest nation in the world. And we were all
mhm,
happy. But then after that came the urban evolution, and people started working more in hospitals, started working more in banks, started keeping long hours. We became sophisticated. We had air conditioned homes and air conditioned cars
mhm.
and air conditioned offices, which are all good. But what it did was that it took us away from that evening stroll to your neighbor. Then came social media, by the way. We thank God for social media, but it's done a lot of things that we don't even know about. Then came video games. Then came all sorts of things that took us away from our outside life. I remember when I was young, my parents would actually take the living room furniture and put them outside, and we'd have a party outside.
Yeah.
So our lives moved from the outside environment into the inward environment. And over the years, you can see how the mental health in Nigeria has declined, and how cancer incidence has risen, and how heart attacks have risen, and all sorts of morbidities have come in. We can't hook it all on vitamin D deficiency, because that would not be reasonable, but we can clearly see the correlation between the movement from outdoor living to mainly outdoor living to mainly indoor living, and the impact that it has had on our health.
Right.
So in a nutshell, ta-da, vitamin D.
So if I were to sort of say what you said in one sentence, you're saying vitamin D is special because one is made by the biggest organ, so that's our first natural cue that is important.
Hmm.
And two, we get it directly from God, from the sun,
Yep.
basically.
Yep.
So it's a big deal.
It's a big deal. It's
Yeah.
a big deal, especially for brown people. And we'll talk about that later.
Yeah. Okay. So in the UK at the moment, I looked at some of the stats. Over 3 million people have osteoporosis. Um, for in America, 44 million have low bone density. There's so many issues that are linked to vitamin D. Though I haven't asked you that, but this just shows that it's really bad. So the question is it possible, because these are not just blacks, these are blacks and whites, and I know we'll talk about blacks later. What is it? Can you talk a little bit about the benefits of vitamin D, even though I've talked about osteoporosis and all of that? What does vitamin D do for us?
Do you have a day? Do you have a full day?
I
No, no.
polite just
You
when I get
politely declined. Well, to do that, I need to tell you a story. It's not a long story. I'm going to condense it to a short story. Um, in 2001, I left residency and I moved to a small quaint city called Eau Claire because idealistic me, I wanted to have a practice where, you know, I could see both ends of the spectrum, children and adults at the same time. And when I got to this community, I just found out that some things did not sit well with me. First of all, the incidence of depression was startling and amazing. I started seeing people who were on two, three, four antidepressants, and nothing was happening. They would still come back and say, I'm depressed. And I would look at them, and there would be no reason for them to be depressed. They had good families, they had money, they had children, husbands, wives. Everything was right. And I remember someone actually telling me, I don't know why I'm depressed. The
Mm,
saddest thing was hearing a 75-year-old man say, oh no, I have a plan for how I'm going to kill myself. And the insurance company will not know about it because I'm tired of living life. I just want to go. This man
mm,
had acres and acres of land, very rich. He said, I've sown it all up, I've given everything to my children, and I'm ready to go. And I'm wondering what would make a man so depressed.
mm,
The second thing I
mm,
noticed was that there was a high incidence of autoimmune diseases, thyroid diseases, type
mhm,
2 diabetes. There was a high incidence of cancer, colon cancer, prostate cancer, breast cancer, and a lot of endocrine and autoimmune diseases. And I actually went to the staff endocrinologist and I said, Aaron, what's in the water over here? Why are people so depressed? Why is it that every third person has hypothyroidism? What is wrong with this place? I had no answer. And like I said, I was treating children, and this young boy comes in. He never would speak to me, ever. You know, how are you doing today?
mm,
Mm.
mm,
With add-on antidepressants, take away antidepressants, nothing would work. And he had a deformity on his chest. And me being the helpful doctor that I was, I thought, okay, maybe this is a self-esteem issue. And like I always say, there's no shame in my game as a doctor. I will always ask a colleague, what do you think? So I went to a senior colleague, Dr. Gonzaga, and I said, Dr. Gonzaga, this boy, I described his history and I described how he always ached when I touched him. And he just said, check his vitamin D level. He vitamin D deficient. And I like, wow, vitamin D. I'd never heard about this before, except in the sense of rickets and bone issues, osteoporosis, osteomalacia. So, not knowing anything about the treatment, I checked his vitamin D level and I checked and it was low. And I gave him vitamin D. I kind of, used my medicine brain and gauged the dose. I dosed him and he came back in 2 months. And when I walked into the room, I said, hello. He said, hi. I said, oh my God, he speaks. He has a voice. Oh my God. He has a voice. He has a voice. I was so excited. I said, so how are you? I started bombarding him with questions because that was the first time he would engage me. And I said to him, I
mm,
said, so how do you eat? What do you eat? I said, do you like milk? He said, oh God, no, I hate milk. And I said, honey, how are you going to get your calcium? How are you going to get your vitamin D? And that began my journey with vitamin D. Unfortunately, I had to leave that. I had to leave that community because of a side story. I
mm,
became depressed. I gained weight. I developed a goiter. My thyroid function started worsening. I was actually placed on an antidepressant by another one of my colleagues, and I took it for a week and I said, this is not me. I'm not depressed. This is not
Interesting.
what's going on with me. So I started thinking that it was the environment that I was. Remember, I said it was a small community, but I had
Mm,
friends, I had people around me. I had turned into the people I was looking at and saying,
mm,
why are you not happy? You've got a good life here. Oh, Claire, if you ever go there, it's the quaintest town ever. I had good restaurants, great living, but I wasn't happy. I was
mm,
depressed. I was gaining weight. My constant refrain was, how are you? I'm tired. How are you? I'm
mm,
tired. And I got to realize that because my practice had grown so much, it's a bit of a long story, but bear with me, you'll understand where I'm going. I was spending more time seeing patients. I would get to work at 8 a.m. in the morning, and I would not leave until almost midnight every day because I had a successful practice. So I was sun deprived. And during the weekend that I would have gone out to get some sun, what was I doing? I was busy resting and recuperating from the long week I had just had. I had no work-life balance. So I
Hmm.
I felt that because maybe it's because I'm in a small city, that's why I'm depressed. So I decided to pack up and move to Minneapolis. And when I got to Minneapolis, one day I was doing a study on vitamin D and everything, and I saw a blurb, and it said that Somali immigrants that moved to Minnesota, in particular, because they cover up, have a tendency to be vitamin D deficient. And I started studying them because I had a huge Somali population. And every time I touch each and every one of them, they'd say, "Ah, Okulaja, your hand is too hard." I'm like, "No, I'm just touching you gently." "Oh, no, your hand is too hard." And then I thought, hmm, Somali, Minneapolis, no sun. Because I'd started reading about vitamin D. I checked
Hmm.
my first vitamin D level in a Somali individual. It was 5. I have seen I've seen vitamin D levels as low as 0, undetectable. I've seen 8. I've seen 6. I've also seen 120. We will talk about that later, you know. And so I started treating these patients. You know what would happen? They would come back and they say, "Oh, I'm pregnant." I'm like,
So it's even improved fertility.
it fertility, but in many ways, in the in the endocrine way, because it helps to make your hormones better, but also they didn't hurt as much. So when their husbands came and touched them, they didn't say, your hand is too hard anymore. So I got this reputation for being the baby doctor.
I should
So
get
people
more
would go,
Somalian men in the UK to get in touch.
"Oh, are
Just
you
in
are
case.
you kidding me?" I think every woman who's in her, and this is a bonus, every woman who's looking for a baby, who wants to have a baby, I always call it getting the room ready. You'll go check your vitamin D level. There's so many people that have just corrected their vitamin D level and they got pregnant. Just like that. Just like that. And so, I got this reputation of being the baby maker. So people would come to my office and say, I say, "Why are you here?" I say, "Because I want baby." I say, I'm not a baby. "Oh, my friend came here and you treated her and she had a baby." So
Oh,
that story went on. And I started thinking, what if what's wrong with these people is what is wrong with me? So I started taking vitamin D. I didn't check my levels. And then after a while, I checked my levels and no, actually, I started taking it. I felt much better. And then I said, this is not scientific. Stop it. Don't take vitamin D. Wait for a little bit. When you start to feel bad, check your levels. And I did, and my levels were low. And that was in 2008, and I have been on vitamin D ever since. Now, talking about the effects of vitamin D, we can divide them into the physical symptoms: tiredness, I've mentioned that, fatigue, joint aches and pains, muscle tenderness, depression, just not feeling good. We talk about the endocrine functions. It affects the thyroid. It affects the adrenal gland. It affects every system in the body. So if you're feeling like an alien in your own body, you need to think about it. Am I vitamin D deficient? Am I vitamin D
yeah,
deficient?
absolutely.
So that was what all that story was all about. But I think it's important that we understand that, some people go to their doctors and they expect their doctors to know about vitamin D. I don't blame those doctors. I did not learn this in medical school. I learned it from studying my patients and coming to understand what vitamin D is and how important it is to our lives. I hope I've answered your question in a little bit of a way.
Yeah, I hope you did. Did. You think you did? Let me see in the comments if they think you did. Well, so wow, that's a lot.
That's a
So
lot, isn't it?
it's like it's like the magic vitamin, isn't it? It
It
connects to
is.
everything. So I opened it up by talking about osteoporosis, and obviously vitamin D is that vitamin that helps the absorption of calcium, and it's so important, right? You've linked it to depression, you've linked it to anxiety levels, you've linked it to fertility, you've linked it
Cancer.
to the neurons, obviously. In fact, I think it was last week I was reading a few articles. The research are still quite small. I do like research, but I think it's overrated because sometimes we can see these things. But this research was sort of suggesting that people with autism, get better. I'm being careful when I say this. I need to be politically correct because autistic people, especially in the UK, like to not don't like to be termed as if they've got some form of disability or disadvantage. So yes, we know that one of the benefits of autism is being able to focus on one thing for a long period of time. So we do have geniuses who are autistic, right? That's one of the signs of autism. You're a genius. So that's one. However, we do know that there are so many other symptoms that they suffer, which are not necessarily genius. They are, social issues and stuff like that, which vitamin D can help with. So I found that really fascinating. I mean, what do you have to say about this
You, you know,
neurodivergent symptoms
oh
and
wow. Oh wow. It's very interesting that you mentioned that. And um, like I said, I had a huge Somali population. But first of all, before I mention that, I wanted to mention something very important, in that we've talked about all that. One big thing that I failed to mention was cancer. Vitamin
mm,
D deficiency has been implicated in the incidence, um, clinical presentation, and prognosis of cancers.
yeah,
Chief of those are breast cancer, prostate cancer, and colon cancer. Actually,
interesting.
there are oncologists who are treating their patients and making sure that they're vitamin D sufficient while going through chemotherapy or when they're first diagnosed, because most people who are diagnosed, not all, most people who are diagnosed have vitamin D deficiency. And the ones that do not have vitamin D deficiency, the cause is usually attenuated. It's not as severe. The prognosis is better. I have seen people who have been treated for cancer and who are vitamin D sufficient go back to zero, ground zero after treatment. And I've seen people say, you don't need chemotherapy anymore. Coming back to the issue of autism, this was an observational thing for me. And,
Mm,
autism strikes very close to home because there's hardly anyone who knows of a family that they don't have anyone who is a little bit on the autistic spectrum or a lot on the autistic spectrum. Observationally, here in the in the Twin Cities, we have a huge Somali population, and
mm,
it has actually been well documented that the highest incidence of autism is amongst the Somali families.
I
And there is
didn't know.
hardly, yes, yeah, you
But
can check it out.
there was a day, let me just please hold that
Not
thought.
a
I
problem.
went to a church in Brighton, for those who don't know where Brighton in the UK, and there were at least five families there. They all had a child, at least one child who was autistic.
Yes,
And
yes.
I don't know how that made me feel. I didn't feel happy about that, even though I know there are benefits of being autistic. But some of them were borderline, behavioral wise, they were not, what you would call the social norms,
Mhm.
and that really broke my heart. So now you're saying it again, and these are obviously Black people, Somalians. So that's interesting, but please carry on.
And so there's hardly any Somali family that you will find that is not touched by autism.
Mm,
The firstborn usually escapes. The secondborn may escape. But by the time you get to the thirdborn, the fourthborn, there is one. And if you find
mm,
a gap between one child and the next child is usually not autistic or less on the autistic spectrum. So in a Somali family, it's not unusual to have a family of six children with two or three of them being autistic. That's a huge burden.
it
It actually, it actually breaks my heart when I see it, and I know that vitamin D can make it better. I actually have a story of a senior colleague. Her son was in the process of being diagnosed with autism, and the
is.
earlier it is caught, and there's some guidelines, there's some vitamin D is a huge topic. I actually think you should bring me back and talk about this, not because I want to be in a show, but because it's too huge a topic to talk about in one go. So,
Yeah,
I'm not advocating that you just start giving your child vitamin D, because it can harm a child. It can harm a child immensely if you don't know what you're doing. So this senior colleague was talking to me about their child. And, me, I'm a pro doctor when it comes to things like that. Whether you solicit my advice or not, if I feel it's going to affect life and destiny, I will apologize and I will gracefully interrupt. And I
Yeah.
said, with all due respect, ma'am, would you try this? And I was very careful to say, please go check his levels. And I gave my recommendations because a lot of people take vitamin D. That's another side. Maybe you want to put that down as a note, but they don't know how to take vitamin D. They don't know what to take along with vitamin D to make it
Mm-hmm.
effective in the body. So I told her all that, and she went away, and I did not see her for a while. And about 4 or 5 years later, I saw her, and we were talking, and she talked about her son and how, and she said, I didn't tell you. I've been talking about you everywhere. That I started everything you told me. I did it to the T. And by the time we got to the where he was going to be evaluated, signs and symptoms gone, gone.
Interesting. Yeah.
He's he needs therapy, he needs support, but the initial symptoms that were there when he was first, when they were first questioning the diagnosis, were gone. She said, "My boy is he's a he's a normal boy. He will go to me and say, 'Mommy, vitamin D.' Mommy, vitamin D.
Yeah.
A kid,
My
a kid. He knows this works. And so yes, there's been a lot of denial, and when you have things that you cannot ethically study, like you can't withhold vitamin D from some kids and not give, and give some kids vitamin D and see what the effect is going to be. And because integrative medicine and natural medicine has been demonized in the medical world, people really tend to be skeptical. But I always say that the taste of the pudding is in the eating and what we have seen. What we have seen. It's incredible. It's actually incredible. It's incredible. It's incredible.
Yeah. Wow, wow, wow. Okay, so we've talked about benefits. For those just joining, we've talked about a lot already. You've missed. Please watch it back. Watch. Um, but yeah, so let me just say. So being a nutritionist, I'm quite pro food. Um,
Hmm.
I tend naturally not to, if someone told me they had a headache, I'm thinking more from food perspective. What are you lacking? Are you resting? Obviously, wellness. Are you sleeping well? Is there something you've been thinking about? So I wouldn't default to take paracetamol. That would be the last resort, right? And that's how I think about vitamin D as well. However, you mentioned something really important, that where the main place it comes from is the sun.
Hmm.
So people like me in the UK, you in Minneapolis, sort of stranded. Like, where do we get vitamin D? Because we've barely got any sun, even
Hmm.
in the UK. And I think while you're answering that, you could talk about some of the barriers as well for Black people, because we don't get any sun, and then we're also Black. So I'll just leave that open before I say anything more. Yeah.
Okay. So when you have somebody and they can hardly wait to talk about their favorite topic, that's me. I'm going to talk about my favorite topic. But anyways, coming back to it, I've read something very interesting about the incidence of how vitamin D was discovered, and that's an important clue as to how it needs to be replaced. It was in the 1800s in England, in your
Mhm,
country, and the Industrial Revolution came, and they started having, they had farmlands before, and people were living outside, and the city of London started to form. And so they started having big buildings built close to each other rather than the old flat top, no high rises
mhm,
that they had before. And what happened was that they started noticing that the children were developing rickets and osteomalacia. There was an
mm,
epidemic of it in the city of London. And the observers started noticing that this started when people were no longer exposed to sunlight. The children were no longer exposed to sunlight. So what they did was that they discovered this vitamin D, because vitamin D is not new. The medical community unfortunately has been trying to suppress vitamin D for centuries. Knowledge about it, I don't know why. But the kids now
Hey.
It's cheap. Vitamin D is cheap. Rather than treating for depression for with $20,000 a year, you treat with $20. Do the math. So the children became um, they had rickets, they had osteomalacia, so they started supplementing everything. They started even butter. I looked it up. Butter was supplemented with vitamin D. Soda was supplemented with vitamin D.
Mm,
Cereals were supplemented. Puddings were supplemented. So you know what happened? Because when you do that and you don't have any checks and balances, they started having children who were born with a syndrome that they had abnormal face sheets. I don't remember what it is right now, and they found out that the children had become vitamin D toxic. So what they did, as with all things bureaucratic, they swiped vitamin D from every food, everything except milk. And actually, I was just reading that vitamin D has only just been allowed back in dairy in Italy. In Scotland, which is, there's so many other things that I could talk about. Multiple sclerosis, MS, vitamin D is essential,
mm-hmm.
essential. And Scotland does not fortify any of its products, and they are the hub of multiple sclerosis in the UK. They have the highest incidence because Scotland is dark, it's rainy, it's not sunny, they don't have vitamin D. So all these autoimmune diseases, they just abound. Where were you asking me to be? Tell me again. So I've lost my
Oh,
way a little bit.
yeah, no. So I was asking, in the absence of sun, we'll talk about food
Okay,
later,
okay.
right? But
So yeah,
in the
where we can get vitamin D.
can we get vitamin D?
Okay, so first of all, the most ideal way is to get some sort of sunlight, whether it's very little or whether it's minuscule or just a little. And the best times to get it are between the hours of 11 a.m. and 3 p.m. After that, the possibility of getting vitamin D from the sun is low. So for those who live in like Nigeria and you work in an office, you might want to take off your jacket and take a walk, take your break a little bit outside, eat outside, you'll get some vitamin D.
Mm,
But it's not enough. And the reason why it's not enough is because UVV is what helps us make vitamin D through our skin. And again, we haven't gone through all that. It's a huge, huge topic. And so exposing your body to the sun, not through glass, it will not go through glass, it will not go through any substance, is important for you to get vitamin D. Now, we cannot get enough. So, how do we get vitamin D? A lot of foods are fortified with vitamin D, but there's a lot of deception going on in the food industry market. I
mm,
remember looking at a product and it says fortified with vitamin D, and I was excited. And I looked on the product information and it had 1 unit of vitamin D on it. 1 unit. That's
mm.
not going to work. So, we go to supplements. That is the main way to replace vitamin D. That is
May
the
I
main way that,
let me
pardon me?
just so how many units should we be looking out for food?
Uh,
At least
it's
minimum.
impossible. It's impossible to get enough vitamin D from your food, from the oily fats, from the fish. It's impossible. It's impossible. I can categorically say that it is impossible.
Okay. Yeah. Okay, please carry on. So you were saying supplements, yeah.
Supplements. And when we talk about supplements, there are two types of vitamin D. There's vitamin D2, there's vitamin D3. Vitamin D2 is from plant sources, and it can be traced to plankton, from to get a call. It can be traced to plankton, and the other is vitamin D3, which comes from animal sources. And the ideal vitamin D that we should be replacing with is vitamin D3. Vitamin D3 is the dosing is very confusing. It's, a lot of people don't know what the dosing is. I usually dose in international units. And so vitamin D3 is what I would recommend. Now, with vitamin D3, taking vitamin D alone will not be effective. Oh, I'm taking my vitamin D, but what are you taking it with? Vitamin D is one of four fat soluble vitamins: vitamin A, vitamin D, vitamin E, and vitamin K. I always tell my patients to remember a zinc deck or deca to
Becca,
identify the fat soluble vitamins.
I
So
would remember.
these vitamins need to actually be taken. I think I've lost my volume a little bit. I'm sorry.
No, I can hear you clearly.
Yeah,
Yeah.
I can't hear you. So Taking like no, no, I can hear you now. So taking
Okay.
vitamin D with water only is completely useless. You'll have to take vitamin D with a fat containing meal. With a fat containing meal. I always tell my patients not one swimming in fat, but just fat containing. Because that's what will help emulsify and help the absorption of vitamin D. Also, with vitamin D, you need to take calcium, just like you rightly mentioned. And we will leave the recommendations for calcium to if we have time or not, but you need to take calcium with vitamin D. The other thing that needs to be taken with vitamin D, the other vitamin that needs to be taken with vitamin D is actually vitamin K2. Vitamin K2 is not to be confused with vitamin K1, is involved in the absorption of vitamin D. And it's actually a very wonderful vitamin that helps take plaque away from the blood vessels and helps to develop it and incorporate it into the bone matrix. So you have to take vitamin D with K2. The last thing you have to take vitamin D with is magnesium. And magnesium is a trace element. And what it does is that inside of our bodies, what we have floating around mostly is inactive vitamin D. So we need to activate it. And I think it would be remiss if we didn't talk about how vitamin D gets into the body, but you can put that in later or not. But I think it's important that we discuss it. And so magnesium helps to convert the 25 hydroxy vitamin D3 in the body to the 125 hydroxy vitamin D3, which is the active form of vitamin D. The beautiful thing about vitamin D is that every single cell in the body has vitamin D receptors, and they store a little bit of the 25 hydroxy vitamin D.
That is
So when we take
amazing.
it's amazing. And that's
It is,
why it and
that's
that's why yeah, and that's why it was puzzling to me when we had our recent pandemic that vitamin D was not, you know, blown to like, hey, everybody take vitamin D because it helps with the immune system. The
yeah,
immune system is helped by vitamin D. So one needs to take magnesium to help convert inactive vitamin D to active vitamin D.
right,
So
okay.
that's the way we have to take vitamin D with a fatty
S-
meal, with calcium, with K2 and magnesium.
Okay. So you're looking at a hardcore naturalist, and while you're saying all these things, I'm thinking I'm not taking all that supplements, right?
But
Some
can I
people
tell
might
you
be
why?
fine
But can I tell you why though?
with it. Let me give you my sentiments, right? So,
Hmm.
um, you know, I think during the nutritionist, well, like in class, I'm thinking I wouldn't recommend obviously to my clients to. I'll talk about like foods they would probably find vitamin K or magnesium, and a lot of foods where you find vitamin D, you would find those other vitamins, right?
Hmm.
So things like oily fish liver, egg yolk, and
Oh,
some of those you would find naturally those occurring vitamins. So have you got any like strong arguments as to why we have to take more supplements? Because I remember going to a pharmacist and I said, "Oh, can I have that multivitamin?" And then she said, "Oh, who do you want to give?" I can't remember the conversation, but she basically said, "Well, it's going to turn into pee anyway," as though it's pointless taking these multivitamins. And we've heard it time and time again that it doesn't give anything. So for me, I guess my question is there a way we can avoid taking all these vitamins since they said the popular um the pharmacists are telling us it's useless, or can we get it from food? I'm asking too many questions. So my
no, you can. Yeah,
question
no,
is,
that's fine. You're fine.
can we get vitamin K, magnesium, and all the other things you've mentioned from food, like fats we can get from food naturally. And when we talk fats, we're obviously talking about the good fats, right? Like
Yeah,
coconut
we're talking about
oil.
yeah,
Yeah,
and mackerel,
I'll educate people more about that later,
and
but
mackerel and salmon.
donuts, but basically oily fish would give you some of those really good fats, right?
Yeah.
So can we get those vitamins from those food sources, or are you saying just like vitamin D hormone that the chances of you getting enough from food is low? Are you saying the chances of getting these other vitamins are also low from food? I think that's the question.
Yes, and and it's a sad question for me to have to answer. But somebody asked a question, said, "What's a fatty meal?" Confused. It's not a fatty meal. It's a fat-containing meal. So
Mm,
any meal that you eat that has a little bit of butter, a little bit of oil, a little bit of anything that's just moistened with fat will be sufficient. Some people take their vitamin D with fish oil, which is excellent. They can do that as well. And coming back to your question, it's actually a sad question for me to answer because I was a purist. I was a naturalist. I believe that everything that we eat from the store, that's natural, has all the ingredients that we have. Until
mm,
I started practicing, and I also started checking people's levels. Like I am not somebody. In my residency program, they emphasized a lot the fact that you have to practice evidence-based medicine. So all these things that I'm telling you, I'm checking the levels. I'm
mm,
checking magnesium levels. I'm checking vitamin K levels sometimes, and you'll be amazed at how many people are deficient. Is it because they're not eating well? People would come to my clinic previously, my old clinic, and they'll say, "Oh, just go eat a healthy meal." But what a healthy meal is for someone is different from what a healthy meal is for another person. Like for example, my Somali people will say, "Do you eat healthy?" Yes, but what is a Somali diet? A Somali diet, and I'm so sorry I'm thinking of my Somali people today. It is not intentional. A Somali diet is pasta and bris, which is rice, and goat meat. Complete
yeah,
diet.
I find that
Complete.
delicious well, as a nutritionist. Every time I ask a black person, "Are you eating?" I say, "Yes, I eat
Yes,
well."
yes, yes. I eat well. Yes. Rice and stew every day with a little bit of vegetable and occasionally an egg,
Yeah,
you know, I'm eating really well. And I tell my patients, I say, "Oh, you know, all those colors in the grocery store, all those colors in the market, they are not suggestions. They are mandatory. Take every color. You will get something there.
oh,
They're not suggestions. You know, they're mandatory. But we are dealing in 2024 with food shortages where people eat a lot. We have depleted our soil of nutrients. And there's
absolutely.
a lot of, pollution going on, and that leaches into the ground. A lot of industries that we did not have 40, 50, 60 years ago, not even 10 years ago. So the quality of the food that we're getting is extremely low and extremely poor compared to what we were
Yeah,
getting 20 years ago. So the soil is depleted. We're using herbicides and pesticides a lot. Food is being genetically modified because if you saw a real orange, think about when you were a young girl and they were selling oranges by the street. Most of our oranges were yellow and green. We did never saw orange. But if you put that in a grocery store and you put a regular orange now in a grocery store, which one would your child pick and which one would you pick? You would pick the one that is orange, but that's the one that's been genetically modified. And
yeah,
when we mess with the things that God does to some extent, we lose some of the things that God has put in there
naturally.
that is beneficial to us. It's no
Yeah,
longer there. So we've genetically modified our foods. We have very, very busy lives. So a lot more fast food, a lot more eating on the run, a lot more preservatives in our foods. All that serves to decrease significantly the amount of nutrients we get from our food, coupled with the fact that our animal, oh God, it's sad, you know. And those people who eat meats and chickens, if you go on the internet and just say differences in chicken sizes over the last 20 years, you'll be amazed.
mm.
A full grown chicken
Big.
20 years ago was 1.7 to 1.5 to 1.7 kg. A full grown
Mm,
chicken as of 2005 was 4.2 kg. 4.2 kg. How did they get there? Hormones. And
yeah, that's
so
crazy.
and so
Crazy.
these chickens do not grow to the extent that they need to grow to get all the nutrients. And so you're eating beef, you're eating chicken, but you're not getting enough iron, you're not getting enough B12, you're not getting enough of any of those nutrients. And that's why we have to resort to supplements. The
Mm,
pharmacists are quite correct. Giving a blanket supplement is like saying that every size will fit every person. No, you'll get a little bit more of this than you need, a little, not as much of this as you need, and so on and so forth. And it creates an imbalance that may actually be harmful. I'm done.
okay. So much for clarifying. No, there'll be people who are wondering, like, oh, I have to kind of start taking supplements. Definitely, I'm on that table. So thanks for the clarity. So let's talk about blacks a little bit because we are black people.
Hmm.
For those who don't like being called blacks, you might be brown or light brown.
BIPOC.
Whatever suits you. But we come in peace. I'd like to understand why vitamin D is especially important for us.
Okay. So, if we look at all the countries in the world, which is why I actually believe that people are black, white, green, blue, and everything in between. If we look at all the countries in the world where the sun is intense, the skin is darker.
Mm,
Every single country, even if it's a European country. Like if you go to Spain or Greece, you'll find out the people
yeah,
are more swarthy, people are olive toned rather than pale. Like if they come from Holland or somewhere in the Netherlands or even Britain, So the people who are darker have melanin in their skin to actually help them to not get too much vitamin D. It is acting as a sunscreen. If you remember, and this is quite elegant to me, and I quote it not because it's from the Bible, but I quote it because it demonstrates what we're talking about. 2 million Jews left Israel, 2 million, and they walked in the desert. And the Bible mentions that God covered them with a pillar of cloud by day and a pillar of fire by night to shield them from excessive vitamin D, excessive effect of the sun, dehydration, and all that. So the color of our skin and how dark it is usually indicative. I say usually because genetics falls into it as well, of
yeah,
the environment that we are from genetically. So let's say, for example, Nigeria, we have a lot of sun. And so to prevent us from getting overloaded with vitamin D, we have our dark skin. And you will notice that the people in the north are much, much darker. The people that stay outside in the northern part of the country are much, much darker than the people who are, like, say, from River State or Ogun State or Lagos State, because the weather is not as hot. And paradoxically, if you look at their women are lighter because it was a paradox to me. But the reason why their women are lighter is because they are in number one hijab, and then number two
yeah,
because they don't go out there mostly in the courtyard. So sunlight, the fact that we are darker skin is protective against getting too much vitamin D from the sun. And so these days we have intense global migration of people who are living in places that they are not native to. And I always
mhm,
say that in the US, we talk about bad outcomes in the African Americans, bad outcomes, worse prognosis. But look at it. We've only been here. I say we because, not because I felt the pain, but I identify with my people. We have only been here for 400 years. So our genes have not had time to acclimatize as much. And so, because we're not getting the amount of sun, our skin is dark, we're blocking out much more than we need to block out. So, for the dark skinned person, your need for vitamin D is higher, much, much, much higher than a person who is of a lighter skin variety. So, if, for example, I went into the sun with a person who was much lighter than me, let's say I make 20% vitamin D in about 30 minutes.
mhm,
For the black person or the colored person, that would be 8%. That would be
mm,
about 8%. That would be almost fourfold or fivefold less than a more fair skinned person would be, because they don't have the melanin, they don't have that sunscreen, they absorb it more readily from the sun because genetically, historically, geographically, that is what they have adapted to the environment with. So they get maximum amount of vitamin D with little exposure. But because we are black, even if we spend the same amount of time in the sun, we can never ever get in as much vitamin D as a person who is lighter skinned, which makes it more important to the black person or the colored person to be vitamin D sufficient. And which is why when we look at it, diseases have worse prognosis. We in Nigeria with the Industrial Revolution, we had young women having breast cancer. Young women, a
mm.
combination of oral contraceptive pills, low vitamin D, sedentary lifestyle, poor diet, a perfect storm for cancer.
Yes, Good recipe for cancer.
Good
Yeah,
recipe for
absolutely.
cancer. So it's really, really important. Also, infertility. We've seen it so much over the years that it has increased in the Black population, in the colored population. It's not a conspiracy theory that somebody is out to get us. It's that we don't understand our environment, our genes, our requirements, and what our ideal milieu should be.
Yeah,
My
yeah.
ideal milieu should be that I go out in the morning, get as much sunlight as I can. Come
Mhm.
on, get happy. And then I go to work happy. And then I come back happy. And if you look
Yeah.
at, last thing I'm going to say is that if you look at even the swarthier nations of the world, they start work late. They start work a little later so they can have family time, go out into the sun. They have siesta, and then they come
Mhm.
back and they work for a little bit, and then they go home and have dinner. So they're making the most of their environment. But for Black people, we have to go with what is ideal for us. And in the absence of being able to get that, we have to supplement.
Yeah. Makes sense, yeah. And talking about supplements in the UK, vitamin D at the moment, they tell us to take 10 UG per day.
What
I know you have
is
your
10
reserve.
UG? What's 10 UG? How many units is that? I think I
Recommend
think I think if
um, just because of my professional boundaries. If you want special recommendation from Dr. Adepero, please send her a message. But
no, no,
the recommendation is vitamin
I,
D, it's 10 UG per day. I think
which is that's 1,000 or what?
no
It's
1,000. No, it's
it's less than 1,000. It would be less than 1,000 because I think it's about because 1.25 is uh yeah, it's less than. I'm not used to. This is a fault that I have. Forgive me. I only deal with international units. I don't deal with the micrograms per. I don't deal with the micrograms.
yeah, we do micrograms. I don't know the equivalent. Maybe someone in the chat can help us because I haven't got my laptop. However, that's what they recommend. You go in America, they might have recommendations. Wherever you are, follow the recommendation. However, if you're Black, I would say don't go by the general recommendation. Get
Yeah.
in touch with privately. Because of my professional boundaries, I'm not allowed to recommend anything outside of what would be recommended, by the professionals. But like Dr. Adepero does, she tests people, she will check your levels and then recommend a higher dose. So you
Yeah.
may want to see your GP and say, can you check my vitamin D levels? Because I'm learning a lot about vitamin D and I'd like to see if I need to take a little more than 10 micrograms, for example. So that would be what I would suggest to everyone listening who's thinking, some of these symptoms they've spoken about, I experience it. I feel pretty depressed a lot. I've got tingling hands, signs of arthritis and osteoporosis or whatever you think this thing is landing with me. Or I've got a son who might be autistic and I'm thinking, we don't even think about vitamin D. What could we do? So yes, happy to have that conversation with you. And obviously we've got a medical doctor here as well who would, although she's in America, but it's the world is so small now with Instagram and Facebook and stuff like that.
I'm gonna put a caveat on that. I also cannot give blanket recommendations regarding supplementation. There are 1,001 articles out there. I would just say that one should be very, 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 very careful because
Mhm,
in as much as vitamin D deficiency is harmful to health, vitamin D toxicity is even more harmful.
mhm,
I have a patient that I gave a recommendation to take 50,000 like once so over often because I have to keep to my, and she was taking it every day for 6 months. She ended up in the ICU. She ended up in the ICU. She was out of her mind.
that
She
is
had stones.
not.
Yeah, it was not good. And so we were able to find out that she had actually misunderstood the directions and was taking, a high dose every single day. So this is my recommendation. Go to your GP, like my lovely sister has said, Miss Adeze, and find a doctor who is vitamin D friendly, who knows how to correct vitamin D. I can tell you about the serum levels that you should expect. That is okay. A lot of people say that, oh, if you have a serum level of vitamin D of 20 to 30, you are fine. That's okay for your bones. But for well-being, for cancer prevention, autoimmune health, just overall well-being, you need to have a level of between 60 to 80. 60 to 80. And that is
I think
across the board. Yeah,
yeah,
60
that's
to
great.
80 nanograms per milliliter or 60 to 80 micrograms per milliliter. And there's an equivalent for it in millimoles in the UK. I do not know what that is, but it is important. I cannot overemphasize it. Is it important that you partner with your doctor or a qualified integrative medicine physician? The last thing I would say is that some people, you may have to spend money on it and go see a specialist on the side. It's an investment in your life that will always pay off. So,
Absolutely.
yes, yes, an investment in your life.
So, vitamin D is such a big
It's
topic. We haven't covered on
huge. We haven't
100%.
even scratched the
I remember
surface.
he is here today. I remember sending an article which showed that if you have skin discoloration and some other issues we have with our skin is due to low vitamin D. And there's research to prove that. So we haven't scratched all the surface with vitamin D. Is the part, and that's why it's like it's not your regular vitamin, it's a hormone, it's something that the body needs to function. It's already 9:30 and I didn't want
Oh,
to go above an hour.
wow.
Yes, I know. Time
Time
flies
flies
when
when you're having fun.
so, but close.
Can we look at the chat and see if we can answer some of the questions very quickly? I saw some questions come up. Maybe there'll be some of them that we can answer really quickly. I don't know. It's up to you, ma'am.
No, I looked and there was no question. The one
Okay,
to me,
thank you.
you
As was
answered it.
answered. Thank you.
People can ask questions now, this last few. Yeah, this was enlightening, absolutely. So, you said something earlier, which I haven't forgotten. You said we could talk about how vitamin D gets into the body.
Okay, yes. And very
Um,
quickly, I'm just gonna say it. Oh, that somebody said it. The correlation between vitamin D and sunscreen.
yeah, I was talking about that.
It blocks vitamin D. It blocks
Because
vitamin
it's
D.
so common right now. I mean, the
Yeah.
skin industry in Nigeria is blossoming. Like almost every celebrity has a skincare product, and they
Mm-hmm.
sell things buy your sunscreen. It's
Mm-mm.
covered.
Mm,
And just
mm, mm, mm,
so
mm,
yeah,
mm.
that's a question. I guess
Yes.
that's important to
Yeah.
answer.
Sunscreen blocks vitamin D completely. It completely blocks vitamin D. And if you're going to be using sunscreen, you better be supplementing with vitamin D. You better be supplementing with vitamin D because what people don't realize is that, yes, your skin will look lighter. You know, my skin has gotten lighter, by virtue of the fact that I live in Minnesota. I tell people I'm part of the frozen chosen. In in the winter, our temperature here is an average of 25 degrees Fahrenheit. So I am in the freezer for 6 months of the year. That's why I look like I'm in the freezer,
Mm,
but
you look fabulous.
it suits me. Yeah, I've actually to tell you the effect of vitamin D and the skin and why it's so popular. I have actually probably lightened like up to 10 shades since I moved to the United States,
Mm,
and especially more since I moved to the Midwest because we don't have a lot of sunlight. I've lightened a lot. People actually think I lighten my skin. I don't.
mhm,
You know, I've lightened a lot. The most I use on my skin is vitamin C serum, collagen, vitamin E. That's it. No hydroquinone, no nothing. I don't. You can't be using that indiscriminately. That's another story for another day. But sunscreen will effectively block vitamin D production. And one cancer that people do not know that is even more deadly than squamous cell or basal cell cancer is melanoma. In
mm,
Australia is the melanoma capital of the world. And I have a friend who practices there. I have friends who practice there. Vitamin D, they have to have vitamin D because vitamin D deficiency has been implicated in increased incidence of melanoma, which we know is the deadliest skin cancer.
mm,
So while you're making your skin beautiful, make your system beautiful also. And
abs-
so vitamin D is formed by UVB rays hitting 7-dehydrocholesterol in the skin. So your vitamin D is actually, the production actually starts in the skin. And the UBV on the acting on the 7 dehydroxycholesterol now turns it into 25 hydroxy vitamin D3, the precursor to the inactive form. And then it is taken to the liver and stored in the liver. And from the liver, it then gets transported to the kidneys. And that's where magnesium comes in and helps to convert 25 hydroxy vitamin D3 to 1,25 dihydroxy vitamin D3, which is the active form of vitamin D. So even in the production of vitamin D, you have to have a healthy liver. It's important that you have healthy kidneys. So it's not just, okay, I'm going to take vitamin D, that's it. You have to keep the rest of your system healthy as well. Because
Oh,
if there's a
mm,
substrate and there's no receptor for the substrate, it's not going to work.
oh, so
If you're
that
taking it, I'm
means,
sorry?
sorry, you're saying that things, if you're taking high alcohol intakes, things that put pressure on the liver, you're not hydrated, you're a coffee person, you're taking like 7 cups of coffee a day, your liver, kidneys
Which, by the way, coffee causes severe osteoporosis for those coffee
are
drinkers. Too
okay.
much
So,
coffee. Yeah.
so what you're invariably saying is even if you take lots of vitamin D, you might not be able to absorb it properly
You
because
might
your
not be
liver and
able,
your kidney. Mm,
yeah. If people who are sicker, it does paradoxically heal the system.
mm,
So don't lose
mm,
hope. Don't say, okay, my liver is bad. I'm not. No, actually, vitamin D heals. Vitamin D heals your
mm,
system. So as you're healing, and if you look at it, if a person is depressed, they're more likely to abuse alcohol. If a person is painful, they're more likely to abuse pain medication. So I have seen people actually come back to life with vitamin D. I had a
mm.
woman crawl into my office. She was crawling. And when I first knew her, they said that she was in the ER every week, every single week. They knew her. They said, okay, ma'am, you're here. Let's give you a bed.
Mm,
When I checked her vitamin D levels, it was at 8.
mm,
And now her
mm.
vitamin D level is constantly in the 70s. Oh my goodness. This woman, she comes into my office, made up, earrings. It looks like she has unaged. She has unaged,
Yeah.
by herself, she looks good. And her daughter said something to me. She said, Dr. O, I'm so glad my mother came to you before COVID hit because we surely would have lost her.
Absolutely. Oh,
We
wow.
surely would have lost her. Vitamin D
Right.
saves lives.
It does. I think that's a good place to end. I
Yeah.
know you have so much more to
Oh, no,
tell.
no, no. I'm okay. I'm okay.
Yeah. But yeah,
It's my, as you can see, I'm not at all interested in vitamin D. Not at all. Not at all.
But yeah, I know Dr. Adepero was talking a lot about like agriculture, all the things I can't pronounce, and but some of you might think, okay, that's a bit too techy for me or medical for me. I'll just say in simple terms, all she's just saying is vitamin D comes from the sun. That's the preferred source. So, between 11 and 3, if I summarize, that's when you get the best out of,
You're
the
welcome.
sun. If you miss it, you take the supplement, but remember that supplement, you don't just take it alone. It needs magnesium, it needs vitamin K, it needs a lot, it needs fat soluble, it needs fats to be soluble to digest properly. So basically, things like good fats like coconut oil, oily fish, things like
Okweko, for those in Nigeria, okweko, like mackerel.
yeah, mackerel,
That
yes.
cheap fish is very nice.
Things like that. Those are some of the good fats that would be really good to have in mind. So if you're taking vitamin D for your breakfast, if you're eating a good breakfast with oily content, then you might just absorb it really well. Before we go, is there like because today I didn't take my vitamin D in the morning and I was like, oh, I'll just follow nature's whatever. I'll wait till tomorrow late
Take
morning.
it.
Can I take it at night? Is
Take it.
that okay?
You can take vitamin D at any time of the day. You
And
just have to fulfill all those conditions. Take it
yeah,
with
so
your with a fat containing meal with K2, which is available widely. And you actually have some vitamin D supplements that have K2 incorporated in it. And you have some that have vitamin D, K2, and magnesium. You just have to maybe research it a little more. And it's usually going to be the general recommended concentration. It may not be enough to treat the deficiency, but at least it's a start. It's a start.
yeah, and someone's typed it in there so beautifully. Yes, D3 is the one from the sun and also from
From
animal
animal.
substance. And we've said milk is the least, even on the NHS website, it says categorically, you say, oh, I'm drinking milk, I've got my vitamin D. No, that's a
No,
scam.
that doesn't work.
To take it. So, fish oil and stuff like that, calcium, vitamin K, magnesium, and you call it Keta. That's how to remember it.
No,
So
deca,
Deca
deca,
rather.
deca or a zinc deck.
Okay, so what's the D?
D is vitamin D.
Okay,
E is
vitamin D, and then
vitamin E is vitamin E, K is
vitamin
vitamin K, A is
K,
vitamin yeah.
vitamin.
And just as a plug-in, anytime you mention these four vitamins, you have to be very careful because they get retained in the body because they bind to fat cells. So these are the ones that you can usually get overloaded on. So you have to be very careful and monitor your levels.
Great.
Yeah. And before you go, I'd like to say that, whoever's watching this video, please support Miss Adeze. She didn't ask me to do this. She's doing great work. She's doing an awesomely great work in educating people about living well and wellness and nutrition. Please share this video. Share this video with your friends, with your families, people you know that. I know this is her plug, but I'm plugging her also because I know that she's doing a great, 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 great job. And thank
Yeah.
you. Kudos to you. I
Thank you
I really
so
am impressed.
for everything and your time. I'm so grateful. Yeah. Well, the next one will be on YouTube because this is too much good stuff. I've never heard anyone, and I said it in my introductory post a few days ago. Never heard anyone talk about vitamin D the way you do. So yeah, we're so privileged, honored. It's
It's
so
my
good to have you here. So
honor. It's my
your
honor.
time. Respect people's time because I know they've given us about an hour. Some people have
I
been here from the
know.
beginning.
I know. Thank you.
They are going to have to run away, um, and I'll be doing another live soon. I'm not sure of the topic yet, but it will definitely be something beneficial for wellness. So thank you so much. Bye,
Mhm.
everyone.
Thank
Thank you,
you.
Dr. Adepero. You've got a namesake,
Yes,
Dr. Adepero.
she was actually named after me.
Oh,
And she's a doctor as well. She's a wonderful, wonderful, wonderful young lady.
yeah. Thank you for joining. Yeah. All right. Bye, everyone.
God
Okay.
bless you.
Okay. You too.